Welcome to the HMIS Data Quality Training for AB977 grantees. This session will provide an overview of data quality, what it is, why it's important, and how it impacts your work related to AB977. If you are completely unfamiliar with HMIS, we recommend that you first watch the HMIS 101 Demystifying HMIS training video. For this training, our use of the word grantees also refers to any subgrantee, contractor, recipient, or subrecipient that is entering or monitoring client data in HMIS because of AB977. In this training, we will cover the basics of data quality, what data quality is, why it's important, and its cyclical nature. We will look at the 4 components that make up good data quality and touch on common examples of bad data quality in HMIS. We will also review data quality issues to watch out for that are specific to AB977 grantees, namely incorrect grant IDs and funder codes. At the end of the training, we will provide you with a list of tools and resources you can tap into to ensure your AB977 projects maintain good data quality. Before we get started, here are some key terms we will use in this training. Please take a moment to pause the video and review these terms and definitions. Data quality basics. Data quality in HMIS refers to how well the data represents the people being served in your community's homeless system projects and how reliable that data is. We consider data to be high quality when it truly reflects the characteristics and experiences of those people. High-quality, reliable data is critical for decision-making and planning. HMIS data quality can be assessed using 4 different components: accuracy, completeness, timeliness, and consistency. We will cover each one later in this training. The quality of data in HMIS is important for reasons including reporting, needs assessments, community planning, and funding decisions. Data from HMIS is used by the state and federal government to report on homelessness throughout California and the United States. When data quality is poor or when data is completely missing, reporting out of HMIS and HDIS are inaccurate and either underestimate or misrepresent counts of homelessness. At a more local level, COCs use HMIS data to understand and address the needs of people experiencing homelessness in their communities. Like with reporting, bad data quality runs the risk of underestimating or misrepresenting the need for specific services. For example, you may know that there is a high need for permanent supportive housing in your community. But when community leaders are presented with HMIS data for permanent supportive housing, they may see the client counts are low because client data was not entered in a timely manner or was never entered at all. It then looks like permanent supportive housing is not in high demand. This directly impacts your community's ability to confidently use HMIS data to help design equitable and effective homeless crisis response systems. When HMIS data is of poor quality, it becomes difficult to determine and plan for the most needed services. Lastly, HMIS data helps communities and governments determine how best to spend funding to address the most critical needs. And that may mean shifting funding away from a provider that consistently contributes to poor data quality despite repeated training and assistance from the HMIS lead. In addition to what we have just covered, there can be many other reasons why maintaining good data quality is important and useful to you, your agency, your community, and the people you serve. Take some time to think of what these other reasons could be. It is important to understand that good data quality is an ongoing cyclical process. Because new data is always being entered into HMIS, the quality of data in HMIS has to be continuously managed. Though each COC may have a different approach to maintaining data quality, in general, the HMIS lead reviews data in HMIS, pinpoints areas of concern such as low utilization rates or high missing dates of birth, and notifies the agency responsible for entering that data. If you have questions about how to correct data in HMIS, including what to do if data cannot be corrected, your HMIS lead will be able to provide you with the necessary training. On top of making these corrections, grantees will continue to enter in new data into the system. That new data is eventually reviewed by the HMIS leads, and so on through the cycle. The HMIS lead then pulls HMIS data for quarterly reporting in HDIS. Because the data that goes into HDIS includes data from all projects in HMIS, not just those specific to AB977, it is critical that you partner with your HMIS lead to ensure your grant ID and funder code are correct and properly associated with your project in HMIS. Now that we know what data quality is and why it's important, we can dig deeper into the 4 components of data quality, what they are and why they are important on their own. First is data accuracy. According to HUD, data accuracy is the degree to which data reflects the best representation of the client's real-world situation and the programs that provide housing and services. This means that data entered into HMIS reflects actual and true client information such as their demographics, when they entered a project, what interventions and services they received during their time in a project, and their destination if they exited the project. We want to recognize that the accuracy of data in an HMIS can be difficult to assess. It can depend on the client's ability to provide the correct information about themselves or family members, the way that a question is asked by a case manager, and the HMIS end user's ability to document and enter the data accurately into the system. A few common examples of inaccuracies can include a person who was living in an unsheltered location before entering a project has an inaccurate prior living situation entered of living with family or friends, which makes them lose their chronically homeless status and eligibility for supportive housing. An adult parent's date of birth is entered incorrectly, making them appear under 18 and the household to be considered a child-only household. Data completeness is the degree to which all required data is known and documented. Partially complete or missing data can negatively affect the ability to provide comprehensive care to clients. Missing data could mean the client does not receive needed services that could help them become permanently housed and end their episode of homelessness. Grantees should attempt to have as few null, missing, data not collected, client doesn't know, and client prefers not to answer responses as possible. That said, clients can decline to have their data entered into HMIS. However, grantees should ensure data is not missing in HMIS for clients who did disclose their information. COCs often set a baseline for data completeness for each project type. For example, you may find that your COC allows for more missing data for a street outreach project than for a rapid rehousing project. Check with your HMIS lead to see if there are specific local expectations surrounding data completeness for your project based on its type. Here are some examples of incomplete data situations. A rapid rehousing project does not enter clients' housing move-in dates. As a result, all the people being served appear in reports as not living in permanent housing and are counted as experiencing homelessness. For all clients, a shelter reports race and ethnicity as data not collected. As a result, the provider and COC cannot determine whether people of certain races are not being equitably served by emergency shelters in the community. Timeliness is the length of time that elapses between data collection and data entry. Entering data in a timely manner can reduce human error that occurs when too much time has elapsed between data collection or service transaction and data entry. The HMIS end user doing the data entry may be relying on handwritten notes or their own recall of a case management session, a service transaction, or a program exit date. The sooner the data is entered in the system, the better chance the data will be correct. Timely data entry also ensures that the data is accessible when it is needed, either proactively, like for monitoring purposes or meeting funded requirements, or reactively, such as responding to requests for information or responding to inaccurate information. In other words, the sooner data is entered into HMIS, the sooner it is available for reporting, prioritization purposes, data analysis, and data-driven decision-making. Like completeness, COCs may have a timeliness baseline that differs by project type, with some requiring more stringent data timeliness standards. Again, check with your HMIS lead to see if there are specific local expectations surrounding data timeliness for your project based on its type. Here are two examples of issues with data entry untimeliness. Clients exited a street outreach project, but their exit dates were not recorded in HMIS for several months after the data had been submitted to the estate's HDIS. As a result, the COC's number of people experiencing unsheltered homelessness were higher and exits from street outreach were lower than reality. A rapid rehousing project closed when they stopped receiving federal funding, but the project was not end dated in HMIS when it closed. When the COC submits reports to HUD, it could appear that the project was still open and there were beds that were unutilized due to a lack of need in the community for that housing resource. Consistency is the degree to which all data is collected, entered, stored, and reflective of the use of HMIS as a standard operating procedure across project types and providers using HMIS. For example, a permanent supportive housing project run by grantee A should have the same workflow and see the same data elements in HMIS as a permanent supportive housing project run by grantee B. This kind of consistency helps to ensure that data is as complete and accurate as possible at both the data collection and data entry stages. Consistency may also refer to the data storage and overall reliability of the HMIS database management process, both of which are the responsibilities of the HMIS lead and the COC. In this regard, consistency bridges data quality across data collection, data entry, and data management stages and should be considered a shared responsibility across multiple HMIS partners. Here is an example of data inconsistency. An HMIS end user collects all the data for clients at a shelter project, but only enters some client records, which makes it seem like the project is underutilized and the COC does not need more emergency shelter beds. Let's spend some time talking about some common data quality issues in HMIS. These issues could impact you and your clients regardless of project type or funding source. First are issues with client universal data elements. The first major common issue is missing or invalid Social Security numbers, or SSNs. SSNs are essential to an HMIS's ability to deduplicate client records. Funders may require SSNs for eligibility purposes. The SSN data element may be considered complete with the last 4 digits of a unique SSN provided, which would be considered a partial SSN, or all 9 digits of a unique SSN provided, which would be considered a full SSN. A high percentage of missing SSNs has a considerable impact on data quality. Closely related are issues with complete dates of birth. Complete dates of birth are needed to calculate the age of clients served in projects and to determine their household type. A high percentage of missing dates of birth leads to a high percentage of unclassifiable households. You may know that your project serves a lot of families with children, and you want to make the case that funding should be expanded to help more families. But if there are a lot of missing dates of birth in your project data, it may seem like your project served fewer families than it did, undermining your cause. If your project has a high rate of missing or invalid Social Security numbers or dates of birth, seek out opportunities to understand any potential barriers to collecting this information. Work with your HMIS lead to get technical assistance and training to address these barriers and improve the completion rate. Another common issue involves enrollments with no identified head of household or more than one head of household. Each distinct household must have one and only one client who is identified as the head of household for the duration of the household's enrollment. Note that when we use the term household here, it could be a household of one or more individuals. If the group of persons is composed of adults and children, an adult should be designated as the head of household. There are several reasons why a household record may mistakenly have no designated head of household or multiple people assigned as the head of household. For example, sometimes the person who was originally identified as the head of household exits the project before the other household members. If you exit that person but do not identify a new head of household for the remaining household members, that can cause an issue. Some HMISs may assume a household's composition did not change between enrollments, which can create issues in cases where some household members enroll in a project but not others, or where people who were previously in separate households are now presenting as a single household. If you are uncertain how to correct household records where there is no head of household or multiple heads of household, please contact your HMIS lead for assistance. All clients must have a project start date that indicates the beginning of the client's participation in a project and an exit date that indicates when they are no longer participating in the project. Note that different project types define the project start and end dates differently. For example, for emergency shelter, safe haven, or transitional housing, the client's project start date is the first night the client stayed in the project. And for permanent housing projects like rapid rehousing or permanent supportive housing, the client's project start date is the date the client was admitted into the project. Likewise, for emergency shelter, safe haven, or transitional housing projects, the client's project exit date is the last day of continuous stay in the project before the client transfers to another residential project or otherwise stops residing in the project, or for night-by-night emergency shelters, the date after their last bed night. And for permanent housing project enrollments, the exit date is the last day the client receives rental assistance or supportive services. Clients who become permanently housed during enrollment in a permanent housing project must have a housing move-in date. Clients in permanent housing projects that exit directly to permanent housing must also have a housing move-in date. This is true even if your project did not contribute to rental assistance for the unit. If a client is transferring into a permanent housing project from another permanent housing project, the move-in date should be the same as the project start date. If the move-in date is before the project start date or after the project exit date, it is considered invalid. When clients have enrollments for different projects with dates that cross each other, we say those enrollments are overlapping. Some types of project overlaps are okay. For example, you may have a client in emergency shelter who is also enrolled in a rapid rehousing project at the same time because they are receiving housing placement or navigation services. So long as there's no move-in date entered in the rapid rehousing project, it is assumed that the client is still homeless and this enrollment overlap is fine. However, most overlapping enrollments between emergency shelter, transitional housing, and safe haven projects are considered data quality issues because the client cannot physically be in more than one shelter bed on any given night. If a client moves from a shelter project to a transitional housing project, or even from one shelter project to another, they must be exited out of the first enrollment to avoid an overlap with the second enrollment. There are some case-by-case exceptions to this general rule. If your client's situation seems more complex, reach out to your HMIS lead for guidance. There also should be no overlapping enrollments between permanent housing projects if they have move-in dates that indicate the client is housed. Again, this kind of overlap implies the client is in more than one simultaneously, which is impossible. This type of overlap can be especially tricky because often projects that provide supportive services are set up as housing projects in HMIS because of grant requirements, and clients wind up enrolled in multiple housing projects. To avoid this issue, some COCs may split a single project into multiple projects based on services provided or clients served. Lastly, a more straightforward subset of overlapping enrollments is duplicate enrollments. This is when a client is entered into the same project multiple times with the same exact dates and enrollment information. This can sometimes happen when duplicate client records are merged in HMIS. You may need to reach out to your HMIS lead to delete duplicate enrollments. All shelter and housing projects must have inventory information in HMIS, meaning the number of available beds and units must be entered for these projects. This includes projects that are voucher-based. Available beds and units means those that are either occupied by clients or could be occupied by clients. For grantees and entities complying with AB977, inventory data shows how many beds for people experiencing homelessness have been supported with state funding. Inventory information is typically entered into HMIS by the HMIS lead, but the HMIS lead relies on providers to tell them how many beds and units are available within a project. The HMIS Data Standards Manual provides guidance on estimating beds and/or units when the number is not fixed, like projects that use vouchers or tenant-based rental assistance. Inventory should be updated when there are significant changes in the number of beds available. Minor day-to-day fluctuations do not need to be updated. Grantees should ensure they are updating the HMIS lead when there are changes in the number of beds available. For example, if some beds are not available to clients because of ongoing renovations, it's worth reaching out to your HMIS lead to update the number of beds and units the project has. Another thing to keep in mind is that bed inventory in HMIS is broken out by the following household types: adult-only households, adult-child households, and child-only households. Often, projects have a mismatch between the household types of the clients they serve and the inventory recorded in HMIS. For example, a project may indicate to the HMIS lead that they have 10 beds for adult-child households, but the project only served adult-only households. In cases such as these, the general recommendation is to switch the household type for the inventory. This may seem counterintuitive to grantees who do not set aside a specific number of beds for a specific household type. For many grantees, all household types can be served in their AB977 projects. But bed inventory in HMIS is meant to reflect, as much as possible, the real-life utilization of those beds. Going back to our example, having a single inventory record for a project with 10 adult-only beds does not mean that the project can only serve adult-only households. Rather, it indicates that, at least for the dates indicated in the inventory record, adult-only households use the available beds. If, later on, the project sees a shift in the household type served, the inventory can be updated again to reflect that change. Now let's talk about AB977 specific HMIS data quality issues for funding codes and grant IDs. The AB977 funder code identifies which projects in HMIS are funded by programs required to comply with AB977. Without the correct funder code, state departments will not be able to identify a project as receiving their program's funds. This means without the correct funder code, HDIS data on state programs will not be complete and not fully represent the experiences of all clients served by that funding. It is important that the program funding codes are entered exactly, no extra letters, spaces, or characters, as written in the AB977 HMIS project setup instructions for your department and program. Your HMIS lead may be able to identify your correct funder code based on the AB977 HMIS project setup instructions, but it is still a good idea to confirm what they have is correct. While the funder code provides a broad overview of AB977 projects, the grant ID narrows that data down to individual grantees. The grant ID given to your AB977 project is used by state departments to track which grantees that receive the state funding are participating in HMIS as required by state law. If a project's grant ID cannot be matched back to a known grantee or entity, that grantee may not be identified as participating in HMIS. Unlike the funder code, your HMIS lead will not know your grant ID unless you provide it to them. There are several existing tools and resources that will help you with your project's data quality. Your COC's HMIS likely has reporting tools already, such as daily logs, program reports, caseload information, and other types of reports that can help actively monitor data entry timeliness, accuracy, and completeness. Your HMIS may also have bed and unit utilization reports that can help identify if utilization rates are too low or too high, indicators that clients may be missing project start dates or exit dates. Grantees may also have case conferencing meetings between leadership, case managers, and data entry staff that can help identify barriers to timeliness, accuracy, and completeness. Another resource to familiarize yourself with is the HMIS Data Standards Manual, which contains information on every data element in HMIS, provides data collection instructions for each data element, and includes scenarios for tricky, in-real-life data situations. The HMIS Data Standards Manual was written specifically for HMIS users to help with timeliness, accuracy, and completeness. Helpful resources specific to AB977 grantees include the AB977 Project Setup Instructions, which can be found on CalICH's Assembly Bill 977 Homeless Program Data Reporting webpage. These instructions also provide information on funding codes and grant identifiers to support statewide AB977 implementation. The Grantee FAQ, also found on the AB977 Homeless Program Data Reporting webpage, provides responses to frequently asked questions and is intended for grantees, subgrantees, HMIS leads, and other entities involved in the process of project setup and data entry into HMIS as identified in AB977. There are also several recorded trainings for grantees, including HMIS 101, Demystifying HMIS, which introduces grantees to HMIS, discusses the purpose of HMIS, what programs are required to use HMIS, and an overview of the data elements collected in HMIS. Lastly, your HMIS lead will be your most valuable resource and partner regarding HMIS data collection, entry, and maintenance. If you are unsure who your HMIS lead is or have other questions related to this training, you can email ab977_ta@abtglobal.com.